Doctor, thank God that you are here.
Mr. Ndugwa.
Yes.
I'm glad that you are also able to come to the hospital. There are some patients who fail due to the closure of transport.
That is very sad. And how do patients who can't access healthcare heal?
Well, unfortunately, some get here when it's too late and end up losing their lives. Women have been giving birth on their way to health centers, which is not safe.
Of course.
There are a lot of women and girls having unwanted pregnancies because they can't access birth control.
I understand. We pray and hope the situation gets better. So, how is my wife's condition?
Well, you brought Robina right on time, otherwise she could have died.
Where is she? I want to see her. I've been nervously waiting here in the triage for hours.
Unfortunately, she's resting now. She is a bit stable.
Oh, thank you so much, Dr. Med.
Don't thank me yet, because we have an issue that has come up.
I am listening. What are all these papers with the scanned images for?
Well, those are the pictures of your wife's womb.
What are they showing?
We did a scan to try to ascertain what is really wrong with your wife.
And?
They show that your wife has cancerous cells in her cervix.
Oh. I'm sorry, but what's that supposed to mean, doctor?
It means that there is possibility that your wife may have cervical cancer.
Doctor, are you sure of what you are talking about?
That's what the scan shows us.
What?
Yes, my friend. All this means that your wife's life is in danger.
Oh my God. Doctor, what do you think caused all that?
Well, cervical cancer is mainly caused by long-lasting infection with certain types of human papillomavirus. The one they call HPV.
Oh, I have heard about that. So, doctor, what stage is that cancer?
Luckily enough, it is still in early stages.
Early stages, eh?
Yes.
Jay. Okay. What can we do? Any options?
The options are there, but if we are to save your wife's life, I will need your cooperation.
Doctor, all I need is to save her life. I am ready for anything.
Okay. Since the cancer is in its early stages,
Yes.
it can be treated. However, cancer treatment is not an easy treatment.
I know, but what choice do we have?
We must act, because if she doesn't get this life-saving treatment as soon as possible, her life is in danger.
God.
And both of them will die.
My God. Doctor, she needs to start on the treatment immediately.
Yes, that is okay. But she cannot get this treatment while pregnant. This is cancer of the cervix.
What? Doctor, are you saying that to start her on the treatment, the pregnancy must be removed?
Yes, like I said.
Dr. Med, do you know who I am in Sonto? How can I approve an abortion and moreover on my wife?
That's why I said previously that I will need your cooperation.
I am a strange believer and a church leader who cannot stand to recommend an abortion.
But we are trying to save your wife's life.
The Bible does not allow that.
Mr. Ndugwa, I am a believer too. But I'm giving you technical advice as a doctor.
My wife is not having an abortion, and that's fine.
I know and agree with what you believe in. But think about her life.
This procedure is deadly.
Mr. Ndugwa,
Yes?
this procedure allows your wife to get pregnant again. It is safe.
What if we keep the pregnancy, put her on cancer treatment, and see what happens?
I I already told you the risks involved. Your wife is at so much risk should she keep this pregnancy.
Doctor, how can you recommend something like that?
Mr. Ndungwa, it's up to you. But as a profession, I have given you my technical advice.
I think I should go and see my wife. This conversation is over. Excuse me.
Hey, you two! I didn't say you sit under that tree after treating the goats. Go feed the chickens. And I will fire you if you're not serious.
Musime! 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 Anyone home?
Now what is the chairman doing here early this morning? I'm behind the house.
Yee, Musime. I've been calling you all along and you didn't even respond.
Chairman Musoke. Huh? These early morning visits don't please me at all.
I'm sorry.
Don't apologize because you have interrupted my supervision of these workers.
Well, the issue at hand couldn't wait. That's why I came this early.
I can see that you really want to humiliate me this morning.
How again?
How long have we been friends?
Since we were teenagers.
We are now old men and I'm sure you know how I like to treat my guests.
Of course.
Hey, how do you expect me to feed you when my wife and children are in the garden?
Don't worry. I had breakfast at my home.
Next time endeavor to call and make an appointment.
Musime! Musime! You man.
And please, wash your hands with soap. Let us maintain social distance.
Yeah, I'm happy you were taking the coronavirus prevention seriously.
Chairman, this virus does not play games. It kills.
Anyway, I'm here to talk to you about the Health Center 3. You are the chairman of the Health Unit Management Committee, right?
Yes.
Do you understand your job?
Of course I do. Where is this going?
Do you follow up with what is happening at the Health Center?
I'm sorry, but what are you getting at with these questions?
Are you just sitting here or actually going on the ground to do your job?
Chairman, Chairman, don't try to insult me early this morning.
Hey. I'm not.
Then get to the point.
How well do you know Dr. Med?
Of course, he's a very qualified and dedicated professional doctor.
So you also support abortion?
What? What are you talking about?
Dr. Med is encouraging women like Nabila to have abortions.
Are you sure about what you have just said?
101%.
What does that man think he is?
I also told him the same, but he told me that he did his job as a doctor.
So as a doctor, he's supposed to encourage abortion?
Can you imagine? He has no remorse for what he did at all.
Our doctor is encouraging abortions.
Musime, we need to do something before things get out of hand.
I agree. Otherwise, it will become a problem.
Hey, an abomination like that cannot be left to chance.
Hey. What do you have in mind?
I don't know. That is why I came to you.
Thank you. You came to the right person for the job.
Why?
Shh. I know Dr. Med in and out. Yes. Now listen. Here is the plan.
Angela, is this you? I thought you hated washing utensils since way back.
Oh my God! I don't believe this. Amand, you traveled all the way from town to this village?
Of course. Anything for you.
I thought you would be at work. I was going to come there.
Angela, yeah, you have over-traveled to town to come and see me. So, this is the least I could do.
Amanda, you are a true friend. Come and have a seat next to me here.
Okay, thank you. Where are your parents?
They are away in the gardens, but they will soon be here.
Okay.
I'm sure they'll be happy to see you.
Hey. By the way, I love your new hairstyle, eh?
These are just Bantu knots that are temporary until I plait my hair.
I like them.
Thank you. So how is it over there?
Fair.
That's everywhere.
No.
This COVID pandemic hasn't been easy.
I just wish it ends such that we go back to our normal lives.
No. I have lost so many clanmates on this village to eat.
But COVID, I wouldn't even be having any problems if it wasn't for COVID.
Problems? Is that why you wanted us to talk urgently? What is it?
Angela, I just did a pregnancy test and it's positive.
What?
Yes.
Are you serious?
Yes.
Oh my God. So you just gave up on your goal of being a self-reliant, independent lady?
Not really.
Is Alan aware?
Of course.
So what's your plan now?
That is why I came.
Okay. What do you two want as a couple?
Alan suggested we go to some traditional herbalist and remove it.
Amanda, you cannot go through that right now.
That's what I'm also thinking. It goes against my beliefs.
But then you need to focus on your goals and aspirations.
I thought you were against aborting this pregnancy.
No, not really. I simply have a better idea.
Hey, which one?
Go for a safe abortion done by a qualified health worker.
What?
Amanda, girls bleed to death. They become physically disabled and they get fertility problems because of such herbalists.
Angela, you are making it more confusing for me.
No, you can have a safe, less painful and more effective abortion. You can get pregnant again if you want.
Are you sure or you also heard?
I am sure because I have gone through it, but I just decided to keep it to myself.
Won't people see me and tell my mother?
I doubt.
Angela, all I need is to abort and be safe.
Then go and see a doctor.
Imagine, Alan said I would spend days at the herbalist's home.
You see, this is a safer and better option.
But then, I'm still not sure if I want to do it.
Why?
Angela, there is something serious I haven't told you.
What is it?
Chances is brought to you by Coalition to Stop Maternal Mortality Due to Unsafe Abortion. Sisimua.